So in this video, I'm going to walk you through 3 simple ways that you can treat your rotator cuff pain at home. My name is Dr. Chad Kuntz. I'm a sports physical therapist, and I want to make these super simple. So you really won't need much. You'll need maybe an elevated kitchen countertop. You'll need a broomstick, and you'll need your body. All right. So hopefully you've got all 3 of those. Let's start out with maybe the simplest one, and let me just kind of give you an idea of why we're doing this. Remember, guys, we've got 3 of the 4 rotator cuff muscles that are in the back. The other one's way down deep in there, which is the subscapularis. What I found with those who have rotator cuff pain is that the shoulder is really tight. And we think sometimes these rotator cuff muscles are kind of small, but they're not. They're big. The infraspinatus sits on the back of the shoulder blade there, and it's actually a really big muscle. A lot of times people are developing rotator cuff pain just because they're lacking mobility in their shoulder. And so what I'm going to show you are 3 simple things that you can do to actually start stretching out your rotator cuff to help decrease the pain that you're feeling. So one of the common limitations is cross-arm mobility. We all have a dominant arm, well, most likely, and usually in the case of that, our dominant arms have less mobility reaching across our body. Because it makes sense. Like for me, my right arm is my dominant arm, so I'm always reaching and grabbing. So I have a lot less mobility going across my body, whereas my non-dominant arm has a greater ease. So you could even maybe perhaps feel the difference on your own when you're doing these exercises and stretches. So what I want you to do to stretch out your rotator cuff, you're going to take your non-affected arm. So in this case, we'll say my right arm has a rotator cuff pain, my left arm does not. I'm going to reach around and grab kind of the upper arm, okay? Let's start with the palm facing down, but I'm gonna pull my arm all the way across my body and do what we call a cross arm stretch, okay? I'm pulling it all the way across. Now, I've seen this where people want to shrug when doing this. So don't do that. Keep the shoulder down, pull it across. You can kind of side bend a little bit. So I'm gonna kind of open up a little bit even with the neck. I'm going to try to straighten my arm, okay? I'm going to actively try to straighten it. And I feel a really good stretch across my body. So I would hold that for about 10 seconds and then relax. We'll say that was 10. You could do that up to 5 times in a row. And then I also want you guys to play around with this. So when you get to this position, you're straightening your arm, you're pulling it. I want you to try to rotate your hand. So your thumb's pointing down. Okay, just another view for you. Now, I personally feel a bit more of a stretch with that. So if I was consulting myself, I'd say I don't feel as much this way, but if I do that and then pull, yeah, I feel a much better stretch in the back of my shoulder blade. Now watch, on that side, there's that versus this side. It's so much easier because I've got more flexibility. So I'll be curious to see and hear if you feel like you've got one difference, compared to the other. So that's the first one. The second one, we're going to use that broomstick, okay? So my left hand's going to support at the bottom. My left hand is just going to help it up. My right arm's going to just kind of hang on for the ride. It's not going to do too much work. So what I'm going to do is help my right arm up all the way toward the ceiling using my left. My right arm's just kind of hanging on for the ride. I'm reaching up. Now I will say right there, I'm trying to elevate this up towards the ceiling. So when I get here, I'm going to reach, and you can see I'm almost going to side bend a little bit to my left. Why do that? That helps open up my rib cage, my lats, and some of my side rib cage muscles that get tight. In addition to the rotator cuff, they all kind of lock down. So I'm going to breathe in, exhale, and down. Breathe in, exhale, and down. One more time. Breathe in, exhale, and down. So it's funny, we tend to think just because we have a tight rotator cuff that that's the only thing affected. But it's really going to affect the entire upper quarter on that side. So I like to kind of get a little rib cage and thoracic spine and spinal movement with it too. If you guys only went up just a little bit, but you felt a stretch, that's totally fine. Now, luckily, I don't have a rotator cuff pain problem right now, so I can, just work on natural tightnesses. But if you're just kind of getting to here and feeling tight, that's totally fine. Okay, just work it through there. I don't want you to push through pain, okay? Especially sharp pain, so just make sure you're not doing that. You should feel kind of maybe a tightness or a little discomfort, but it certainly should not be tight, and that's really true of all, or excuse me, should not be a sharp pain, and that's really true for all three of these. You should feel some tightness, maybe some achiness. A lot of stretching is really what we want. And if you feel like one of these three is most helpful, then stick to that one. If you feel like a little bit of all three are helpful, then go for that, okay? So use your best judgment on that. The last one I want to walk you guys through for your rotator cuff pain and to treat that is, and this will be a kitchen countertop for the sake of the fact that you guys don't have a medical table at home. It's totally fine. But we really want to stretch out, believe it or not, the lats on this one. The lats are big, broad muscle. They really clamp down, in my experience, when those who have rotator cuff pain. So we want to knock that out. So I'm going to have you put your hand on a countertop. For me, it's maybe chest high level, right in the mid belly. As you progress this, if you could raise it or if you could elevate it, that's totally fine. It doesn't have to be this. Even if this was, down here a little bit lower, I'm sure I could make that work. But I just want to kind of walk you through an example. So let's say this is my kitchen countertop. What I'm going to do is lean my butt back and stretch out my arm up overhead. So I feel a really good stretch right here. Okay. Now notice a lot of my arm is on the table there. And that's kind of what I'd suggest for you, opposed to this. But this isn't the end of the world. I think that's fine too. The way I have it here basically stops right the mid-humerus or mid-shoulder. And then I really get an accentuated stretch right through here. So that feels nice. But there's certainly nothing wrong to, doing something like this as well. So those are the three rotator cuff stretches that you can do right now. Again, hopefully you felt more stretching and alleviation and relief with that. But I didn't want to use this as a substitute, for you to not consult with a medical doctor. I think that's almost always something we should be doing if we're suffering with what we feel like is rotator cuff pain. We don't want to be messing with this. That being said, try these three out, see if they help, and who knows, maybe that's all you needed. I hope it is. So thank you again for hopping on. My name is Dr. Chad Kuntz, and we'll take care. Thank you.